Okay, good evening and welcome to this online presentation, this live presentation here on this evening about how we can support our mental health during this pandemic. This is one thing we've all become accustomed, I think, familiar with the physical symptoms, the physical toll that this COVID-19 has taken upon our bodies and our country and our world. But maybe we don't spend as much time talking about some of the mental, the emotional, the psychological symptoms and toll that this is taking on us as well. And so we wanted to invite a few folks to come and share with us, with you all, with all of us together on some of the ways that we can support good, positive mental health, wellness, wholeness, during this time. And so we started with one of our church members, who is Meg Paisley. She works here in town in Athens with Health Connect America. And she has a colleague that she is co-presenting this with, Kellie Nesmith. And we are so grateful for the both of you being with us this evening. We know that this has been a very busy time for healthcare professionals throughout this year. Those who are in our hospitals and medical clinics, but also for you all. I know that this is a busy time. So thank you so much for donating of your time and your expertise to be with us this evening and to share with us. So I'm going to turn it over to Meg, and Meg can say a few words of introduction of herself and then also introduce her colleague, Kellie. So thank you all for being here.
Thank you.
Thank you, Dave. I was very honored that you'd asked that we come and speak to you tonight because, as we all know, the mental health of our nation is in its own crisis. With everything going on with COVID, we have people experiencing new challenges that they've never been faced with before and weren't quite really prepared for it. I've had professionals come to me and say, Meg, what do I need to do? Because I am drained and there is no end in sight. I feel like all I'm doing is giving, whether it be my clients or patients. And then I've got to go home. And guess what? I have my own family and they need me too. So I thought this was a perfect opportunity and a perfect time for us to reach out and to just talk to the community about mental health. And there are things that all of us can and probably should be doing to prepare our own mental health for what's to come, because that's important, because we have to be ready for whatever's coming because we don't know what it is.
We do not.
So I was very happy that you all asked me to come and speak today, and I couldn't help but reach out to my dear friend and colleague, Kellie. She is our licensed supervisor and training specialist for Health Connect America in numerous states. So I'm very happy to partnership with her for this event tonight.
And she is very happy to partner with you and Dave with the church and the community. So thank you for inviting me. Happy to be here.
Wonderful. So I'm going to start out with sharing my screen. It worked in practice. Let's see how it goes now. Okay. Is it up? Okay. So we're going to be talking about mental health versus COVID-19. And I worded it that way because it is they're battling each other. Our mental health as just a part of trying to survive this world as well as this pandemic. So the things that Kellie and I are going to be going over tonight are the 19 things you can do to support your own mental health to handle stress, anxiety, and isolation during the pandemic. Now, keep in mind that this is going to be for yourself as well as your loved ones. So these are things that you all can be looking out for in people around you too, as well as some maybe knowledge of yourself to figure out where you stand on some of these things as well. All right. So the first thing that we're going to talk about are that all reactions are valid. The fear of catching the disease. Of course, we all want to be super cautious right now, which is why we're coming to you tonight via internet, because we can't meet in public safely right now. Keeping the mask on, which also brings some discomfort for people, because you're now having to talk through a mask, and maybe you had prior breathing problems, and that's its own barrier. And standing 6 feet away, people, and I've noticed just in meetings wearing masks, sometimes we naturally look to the mouth if you can't understand the words. So you're trying to read lips to understand what people are communicating, and now you're not able to do that because you can't read the lips. Or people with hearing impairments, this also is an issue for them. So fear of catching the disease, but also just the discomfort of some of the preventative factors of catching COVID. So another insecurity would be the confusion of school. The school system, I'm sure, is really confused. Teachers are having to learn new ways to teach. Students are having to learn new ways to learn. Pastors are having to learn a new way of preaching online, and the technology joys and fun times that come with that. Being in the family of ministers, I know that that's not their field of expertise. Dave, y'all do an amazing job, but that's not a natural element. So there's going to be some side effects of COVID that are affecting all of our lives. We have more time with family during this time of schools being out. Sometimes that's a joy, and sometimes it's an additional challenge. How do you work and have children and try to teach them and, keep house and fix dinner and grocery shop? But now everybody gets to go. It's another adventure. So dealing with loss of stability and structure and routine, we are all learning new ways. This comes with new challenges, and we're all having to face new things every day, it seems. So family members who are essential workers. So then you're wondering, okay, well, they have to go to work. So then there's additional duties. You do have the extra stress of you're an essential worker. You're out there, you're doing the thing because you have to do the thing because somebody has to do it. But then you have these people that also depend on you at home. So that is also an effect of COVID. Knowing someone has died from COVID, that's tough. That's really tough. And we're coming upon holiday season, which brings seasonal depression for some people. And then having to have a season without a family member who has passed from COVID, or, just being away from family. That's another stressor that comes along with this too. All of my family is in Illinois, and I'm going on, it's been over a year since I've seen any family. That causes stress in people's lives. So these are some of the effects of COVID. So now we will move on. We're just going to dive on in, okay? All right. So when Kelly and I were talking about what we were going to do to start this, we thought it was a great idea to come up with 19 things because of COVID-19, 19 things that we can do to support our mental health. So the first one, and I tell my staff all the time, my favorite is self-care. Now, self-care is going to be, it'll look different to everyone because they have their own special places in their lives that really bring them ease. For some people, it's meditation, or yoga or exercise. Some it's devotional time. Some people enjoy just being in nature, but whatever it is, we need to all find time to do something for ourselves. So whatever refills you, that's what we're looking for with self-care. Some people, it's going to get a massage. That's a good one. I like it. Some people, it's getting their hair done or nails done. But whatever it is that brings you joy, make sure to intentionally find that time to just spoil yourself. It doesn't have to cost a lot of money, so it doesn't have to be getting your hair done, but it could be just a walk down in the woods, just finding things that calms you down, that brings you ease in this stressful time. We have some beautiful walking trails here in Eastern Tennessee. So go find one and just enjoy your time in peace, in quiet. So that's number one.
Well, Meg, I have to tag team in on your number one. I just want to say, if you're anywhere near a river,
Yes.
I don't know. They just seem to bring a lot of peace, and there's a few things you can do. I always look for heart-shaped rocks for whatever reason, but you'll be surprised how many you can find. So I just had to throw that in on yours.
Yep, that's a good one.
So intentional communication. Yep, we have to talk to other people. So communities are important to all of us. We live in tribes, and it is very important to stay connected. Now, if you live alone, it could be very easy just to hibernate in and get used to that. But what we're doing is we are asking you to keep in touch, not only for your own mental health, but for other people as well. So there are a number of ways to do this. Right now, we're on Facebook. If you have the nerve and the talent, you can just go Facebook Live at any time and say, hey, here's what I'm doing. Is anyone else doing anything interesting? By a river, perhaps? I have a river problem. So there's the old-fashioned pick up the phone and call someone. I still like that one. We'd have to add text in there, although text is a little more impersonal and we're looking for a little more intimate contact. Zoom, which is the platform we are using now, Skype, FaceTime, and hey, there are these new cameras that you can get that you can set up on your TV, and you can go back to your couch and they'll follow you around the room. I wish I knew the name of them, but I don't. But my sister calls me from Facebook Messenger often with that device, and I'm sitting here holding my phone on my iPad, yet she's all comfortable over on the couch. So I hear it's a good option. It's best if you schedule time. We're going to call or FaceTime or Zoom or Skype every Wednesday at dinner or after dinner, just so that we know we can reach people. One thing that can happen is if you're feeling lonely and you reach out to someone and they don't answer, you're like, oh, they didn't want to talk to me. Well, what you don't know is they may be on a Facebook Live Zoom call at the moment and not able to answer your phone. So it is important to schedule. Staying connected. If you can be connected within your family, and then you can be connected within your extended family, and then your friends. And so the tree just has many branches. Although I would say people who are quarantined together have their own challenges, but also those who live alone may face some unique challenges where they wish they were telling someone to pick up their shoes or put your plate in the sink. So don't forget your single people out there. right?
That's right. Another thing that we want to focus on is positive thinking. When you cannot control what is happening, challenge yourself to control the way you respond to what is happening, as that is where the power is. And that quote came from the Department of Mental Health and Substance Abuse. So, and it's just a reminder, we can't control one single thing about how COVID is affecting our communities, affecting our friends, our family. But what we can do is control how we deal with that. So it's really easy, I think, for us to get in the Eeyore state of mind right now. I can't go out and do anything. I can't even go to church anymore. Well, the Eeyore type of thinking, that's what I call that. So just kind of spin that around and instead try to think about how can we use this for a positive. Some of us really enjoy going to church in our pajamas and a cup of coffee on the couch. It's fine because we're still worshiping and we're still together. So it's still trying to spin a negative situation into positive light. And there are different ways that you can spin it or trick your mind into thinking positively. Some of that is through prayer or reading, searching positive quotes and putting them up throughout the house. I've done that a few times. I've stuck some on mirrors using erasable markers. You can put them on mirrors, or my son has those bathtub crayons. That's also fun. Leaving little inspirational messages in the shower. Yep, I've done that as well. And really, it's just focusing on reasons that you're thankful. What are you thankful for? Even in this gloomy COVID time, we all have things to be thankful for. And what a perfect time to have those conversations coming into the season of Thanksgiving. So what are we thankful for? Because we're all very blessed and we have a lot to be thankful for. So even in the cloudy times, just trying to spin that thinking into a positive direction.
Oh, we can't help everyone, but we can help someone. This is a great transition slide. I think helping one person helps a multitude of others because you may not necessarily see the ripple effects. Those who do counseling, and we have one identified person that comes in, but it's like a mobile. So families and friends and relationships are connected. And when you pull and change one, the whole thing rejuggles and adjust to the changes made. So, hey, I love this. A conscious effort for one act of kindness that's not part of your usual routine. I had heard people post messages on Facebook that says, thanks for the person who paid for my food at McDonald's. And that happened to me. And so my thing turned into paying for the people's food behind me. So I'm not sure if how far that translated back. And you have to be conscious as a do-gooder. Really, it takes no effort to be in a bad mood and be nasty and snippy. But to be in a good mood and be positive, especially during a time such as this, it's going to take a little bit more effort. Another way to help others is donating items from your home. How many of you have clothes that you don't wear anymore and you don't like anymore? Well, that may be a prized piece of clothing to someone else. Food banks, even though food banks are just doing drive-bys, you can help with gathering food. Now, there's a number of ways. You can be the one that's handing the food off to the cars as they come by. Of course, as safely as possible. And that's our whole disclaimer through all of this is, you have to know what you're able to do and what you can do. So hopefully one of these things rings true for one person. Okay, two people. Right.
That's right. Yeah, that's a goal that I gave my staff one day, just in a normal meeting. I was like, you know what? Because everybody seemed down and gloomy, even in the helping profession. It happens, and so, and we all have clients that we're working with every day. So we are continuously helping others. That's what we do. It's our gig. But I was like, I challenge you this week. I want everybody to do one extra thing that you wouldn't typically do, not for your family, not for your job. I'm not going to pay you for it, but do something on your own for somebody that you wouldn't normally do something for, or something you wouldn't normally do. Because helping others really does help ourselves. It not only affects their ripples in their world, but also it makes us feel better. So, and knowing that we made an impact on someone's life. So, yeah, I think that's a good one, helping others. Okay. Set goals and priorities. You are never too old to set another goal or to dream a new dream, says C.S. Lewis. I like that quote. So this one I put down for the next 3 months. So we don't know what's coming, but what we can do is set 3 personal goals, 3 professional goals, whatever that may look like for you and whatever you may do, and then 3 household goals. So that could be cleaning out your closet, to take the clothing that you don't like anymore and taking that to Goodwill. Or it could be painting the living room, giving it a facelift. It could be, and then professional goals, it could be anything from, there's a little side project you've been pushing aside that really you should probably take care of that, but you just haven't had time. Go ahead and set 3 goals for each area, and then prioritize them from 1 to 9. And then after you've prioritized them, set goal dates of when you want to work on each task. So if you think about one thing per week, you're going to get your goals and priorities done rather quickly. And it doesn't mean you have to do and complete it in 1 week. That means you need to start it. So because giving us something to work for and to strive for with set dates of when you want to start on it, it's going to give you a little extra oomph to get up and get started with it, which in gloomy times, it's easy to not sit there and watch TV and binge on Netflix and but that's not good for our mind, and it's not good for our bodies just to sit around. So that was the reason that we added this goal.
So adding to that, time and energy management. Know yourself and know what you need. You need to know that if you are sitting on a Zoom call for an hour, hour and a half, something's going to start aching. So you're stretching, you're moving, you're getting fidgety, and it's okay to just lift up your computer and stand up if you need to. Sleep. I could get on a soapbox about this one. If you're not sleeping well, please speak to a professional about that. Certainly during this time, without sleeping, you have more stress. The stress hormone cortisol goes up, and when cortisol goes up, it robs from your other hormones. So it just creates a nice little chain reaction that you don't want to deal with if you do not have to. And again, you may need professional help with that. And there are a number of things you can do without medication. So I'm not pushing medication for sure. Schedule your day, even if you're quarantined. My life lives from a list. If I'm going to shower, I'm going to put it on my list. There's two reasons to do that. Number one, I don't forget things. Number two, I get a little small piece of joy from crossing off my list. So whatever is not finished one day, you can forgive yourself, move it to the next day. The key is it stays on the list until it's done. You'll get tired of looking at it after about 14 days and just do it. Well, anyway, that's what happens to me. So what is most important to you? If you're working from home, obviously your work. I would suggest that you make a specific spot that you work from. You can get a mason jar or a coffee mug or whatever and put some items in it that you need for work. And it will help to normalize that process and schedule each task of the day, including a lunch, including a break. So if you can build your day as much as it looks like if you were in the office or wherever you work from, just to bring some normalcy back. That's one of the reasons why I think people get so out of whack is all the things we're used to. COVID has taken a great many of those, although I think there have been a many few positives, but manage yourself. It will make you feel better. That's the theory.
And adding to that too, I think it's also important because now we have children at home that we have to try to teach them. Some of us are non-natural teachers. So trying to keep up with everything they have to do in addition to what we have to do for our jobs, I think time and energy management is important for all of those little pieces as you're trying to put the puzzle together. So just making sure that everything's written down and scheduled, I think helps to just keep some sort of normalcy or routine to everything. And it helps manage the tasks maybe better. So. All right, the next one. I wish I had the that sound. No, I missed it. Okay. Anyway, so the next is the news. Okay. So knowing ourselves, we have to know, is it imperative for us that we know everything that's going on every second of the day when it comes to the COVID or anything news related? Or is it bothersome if we don't know what's going on? So for some people, taking a mental break from watching, reading, or listening to news stories is going to be crucial. For instance, my grandparents, they keep it on 24/7, but that is not good for their mental health. So I've talked to my mom, I'm not there, I don't know what they do, but they really need to have a break where they're not listening to all of the crisis and all of the seeing images of COVID or sometimes it's not very helpful to know everything. So just for yourself, do you need to watch it or do you need to schedule times where you are allowed to watch it or breaks from watching it? And make sure that you're getting the facts. Focus on the facts when you're watching the news. Because I know sometimes there are things that are said that are based on opinions or influential outside factors. Make sure that you're focusing on the facts of the situation, and make sure that it's coming from officials so that it's not someone's opinions on it. And if you're investigating resources, make sure that you're getting information from local government authorities. That's how you know that it's going to be the most factual information shared.
Physical health. Well, we're going back to that daily routine again. I know I just feel better if I shower, dress, makeup, hair, whatever, the whole nine. It makes me feel better during the day. And boy, was there ever a time to be tempted to not do that. It can be right now. If it's for you, try it. See if it does help you to feel better. And you're either going to come out of this COVID-19 with the COVID-19. It's like the what do they call it? The freshman 10. So try to come out of COVID-19 minus 19 instead of plus 19. It's a good time to try new recipes. There's some really inexpensive cookbooks to branch out your cooking library. And hey, if you mess it up, you messed it up. No big deal. Regular exercise. There's a number of things that you can do. There are several free videos on YouTube and just on the web in general. There's a 5 and several yogas, and I think there's a 7-minute exercise routine that if you do that, it's supposed to keep you in shape. These are all online, which you could find from a simple search with Google. Stay hydrated. It's so easy to not do that. I think drinking water, when you first start drinking water, you feel like you're having to pour it in. But after a week or so of that, you crave it so much more. And your body, hair, nails, everything will thank you for it. So let's talk about when to maybe think you might need to do something drastic or something drastic has happened to you. Decreased appetite or changing in eating habits, headaches, sleep disturbances and nightmares, new or recurrent bedwetting, and that's mainly for children, but upset stomach, physical symptoms. And these can all be somatic, meaning that you have an underlying mental health issue that you are not tending to, or trying to stuff it down and act like it's not happening, especially if you've not had them before. But really during this time, pay attention to your body, pay attention to your mind. What are you thinking? How's your body responding? And it's okay to be sad. It's okay to sit with being sad. Sometimes we will fight against it with everything we have in us, when a possible reaction is, you know what, this is a bad time. I'm not doing so well. I'm going to accept that. I know there will be better times in my life. I have faith in the future, and it's just not so good right now. And I'm just going to make it through this, and I'm going to try to care for myself as best I can through this time.
Yes, and then that goes into the staying productive. So not just stay busy with stuff, but being productive. That means finding maybe a new hobby that you've wanted to always get into, just haven't had the time, such as music or sewing or training your pet. If it's anything like my male Yorkie, that might take a little extra longer because he's a little extra special. But so training your animals or doing the household projects that we spoke about earlier, just trying to do new things that's going to keep, again, your mind and your body active, but that you had wanted to do anyway. And that is one of the gifts that we have received with COVID, is that we have a little more time on being able to focus on some of the things that we've always wanted to, but because life is so busy, we haven't had that time. So instead of thinking that we're grounded and we're all having to be stuck up at home or shut in, think of it instead as an opportunity of getting some of those honey-do lists marked off a little bit, Kelly, checking off your lists of the things that you've always wanted to do and haven't been able to. Another one, and this is all based on each family is different, but adopting an animal, a pet right now, caring for an animal can be soothing and relaxing. So of course you'd want to find what would be best for your family. If there are any allergies that went along with animals, make sure you take that into consideration. Don't just show up with something without consulting your village to see what allergies people might have. But there is something very soothing about caring for and petting and enjoying time with an animal. So if that is an option, that's something. I know our animal shelters are still open, so that's also an option. But being productive in your life so that afterwards you can really feel like you've accomplished something and it wasn't just a waste of however long this may end up being.
Enjoying the people on your island, because at times it certainly can feel isolated, and sometimes those people can get in your sand and mess your sandbox up, but it is nice to have others there with you. The difference, I think, with COVID and a regular hard time in someone's life, because life kind of goes like this, and the best you can hope for is to keep it right in the middle. We don't want any big dips this way or that way, because you got to come down or up from those. But most of the world population is in this together. We've not been here before, and hopefully we won't be here again. And so all of these stresses, house, children, money, Christmas, it may be a time to look at things differently. If you or someone you know in your family or your friends are out of work. Remember when we were talking about giving back earlier? It may be a good time to say, hey, I know you're out of work, or one of you is out of work. Would you like for me to adopt one of your kids? I can't do much, but I can help you out some. If you have a Christmas tree or old decorations, I saw on Facebook, someone had a yard full of Christmas decorations and said the address, please come and take what you want for decorating. Decorating provides us a little bit of beauty, so I encourage that. If you can make quarantining fun, please do so. There are several fun activities. We have laid some out in slides later. And children are little sponges. If you are stressed, if you are angry, in turn, if you are happy, if you are upbeat, you are teaching them how to deal with a difficult situation right now. And they watch, they're listening even when we don't think that they are listening. So enjoy those people. And if you're having a hard time, I would just suggest, I'm not doing so well right now. Here's what you can do to help me. I'll be better in a little bit.
Yes. So enjoying people that aren't on your island. So if you are a single person or a one-person household, we recommend that you reach out to other people, whether it be coupled friends, whether it be other single friends. If you're not going out in public, I know a lot of people aren't even eating out in public. Do a virtual meal, or an activity together online, doing Zooming or FaceTiming. I've had dinner with people without being in each other's physical presence, but instead they're at their house with their meal and I'm at my house with mine, and we are eating together as if we were at the same table and still having that conversation. still having that interaction with another person, it really is a comforting thing to know that you have someone, even if it's just, for a dinner. And then making new routines or new memories. That could be with old friends, with new friends. It could be with small groups, church groups. It could be online community forums. But the important part is that if you're feeling lonely, if you're feeling sad or down, that you do reach out and you make those plans with other people, because everyone's lives are a little extra, a little different right now. So scheduling that time with people, it does give you a sense of community, even if it's on a different forum other than seeing each other face to face. But now it's through Zoom or FaceTime or Facebook, or just reaching out to old friends, new friends, and also knowing that it's okay to say no to work, to family, to friends. If you are not comfortable going out in the midst of COVID, if you feel like they're asking something unreasonable of you, by all means, it's okay to say no. And if you have a reason for it, you can give an alternate suggestion on what you could do with them instead of what they were wanting you to do and you didn't want to do. But it's okay to say no. So, yep. And then I liked Mother Teresa's quote, "Yesterday is gone. Tomorrow has not yet come. We only have today. So let us begin."
Healthy eating habits. So good nutrition affects our mental health. We all knew that. A poor diet can aggravate, cause stress and depression, and it can also affect your hormones. We've already talked a little bit about hormones. If there are any ladies out there nearing toward that really special time, or men as well, when we hit the hormone losses and or surges, there are remedies available that you can go to a doctor and get help for that. And I would encourage you to do so if you're able. If not, there are some over-the-counter options as well. We all know processed snack foods, potato chips, the luncheon meats with the nitrates and all. They aren't good for us. So in moderation, I'm not going to take it away from you. That just wouldn't be nice. And healthy snacks, fruits, nuts, hard-boiled eggs, and there's such a variety of nuts. I bet there's one for everyone, unless you are allergic. So then you may have to strike off the cheese unless you're allergic, and then you may have to go to dried fruit. Yeah, right. So a shopping list is a great way to go to the grocery store and stick to it. You can probably, if you wanted to be strict on yourself, guesstimate how much the grocery bill would be, go to the store, take cash, don't take a card, don't take a checkbook, and that way you are limited. Do not shop hungry. I can attest to this, as I'm sure we all can, because everything looks good and you have those impulse buys. And if you can't do all of these, if you can change one healthy meal a week is better than no healthy meals a week. So give yourself a break, do the best you can, just make some efforts toward that.
Very good. One of my favorite things is making sure that you have time to unwind. Time out. A timeout is not only for children. I have told mine on numerous occasions, "Mommy is in timeout, you can't talk to me." And I do that for all of our well-being, because just sometimes you just need a timeout. You need to take a breath, just to calm down from whatever has gotten you stirred up. Sometimes it's just a long day, and sometimes you just need a minute just collect yourself, get your thoughts together, and then you can revisit the situation. So make sure that you know it's okay to say, I'm going to need just a second. I've got to work through this. I'll be back. What we're talking about is important to me, and I want to make sure that I say everything the way I want to say it. So sometimes it's just gathering your thoughts and just taking that time out. Everyone needs one from time to time.
And Meg, I would add to that, if you have something that you're worrying about, or you're feeling grief or a loss, sometimes those feelings can be consuming and they don't seem to go away. Mm-hmm. And so I would suggest you set a timer for 10 minutes and just have at it. Cry, scream, beg, whatever it is that you need to do. When the timer goes off after that 10 minutes, dry it up, get yourself together, and move on. If you ever, how many of those 10 minutes a day, but if you schedule time to fall apart or have a timeout, you can gain a little bit more control over your emotions that way. And if you need support when you're having one of those times, who is your village? Not just your immediate, your extended family, your friends, people you went to school with, people who are acquaintances, but you feel like you might like to know better, your community support. Again, that goes back to volunteering. Oftentimes giving something of yourself will help fill you up a bit. And you ever meet those people who just make an impression on you and you think, I want to know them, I want to be around them. It's okay to make that effort. And joining groups, talk about life, talk about what you're feeling. And one of the things to remember is if we are unloading, we want to be mindful that we don't make a friendship where, hey, Meg, here was my day. It was horrible. Blah, 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 blah. Thanks. Talk to you tomorrow. Next day. Meg, here was my day. It was horrible. So be mindful that they also have had a day, most likely, or will in the future. And we really want to appreciate who is in our village and who else we can bring in.
Absolutely. All right, entertainment. So entertainment looks a little different than it used to. But so here's another opportunity where you can watch some things that maybe you hadn't thought about watching before, whether it be a documentary, a science show. Were you ever interested on anything scientific? I know sometimes it's the antique shopping. They have a channel on that now. So there's lots of different things that you can do. There are apps on your phone that you can download for learning new languages. There are workout apps on your phone. There's an app for almost everything. If that's entertainment for you, if that's fun, or keeping up with the stars, or there's lots of different things that you can do to stay entertained. So and then virtual makeover with friends. This also could be cleaning out your closets. You'd be amazed how much fun that could be, because you're going through each other's stuff and then you're trying stuff on. And then so just doing more of the interaction virtually instead of hanging out with your people, or virtual church services or small groups, doing things that you enjoy doing, but just at a distance now. So it's just learning new ways to find entertainment or find fun out of life.
Okay, young children at home. So we were trying to come up with some ideas that you've not already thought of. And so these are a little bit out of the box. Of course, cooking. But now, cooking can mean a lot of different things. Cooking can mean making something from the science project from the science show that you watched, a science project with baking soda and whatever else goes into it, but it can be really fun. A dance party. If there are 3 of you in the home, 1 plays judge, 2 dance. You don't have to do a whole song. And board game night, my personal favorite. Video games. I think the interactive video games are the best that require physical movement. I have to have my disclaimer on video games. I know they're a wonderful babysitter right now, but if there's any way that you can avoid hours upon hours, it will most likely make a better person in later years. They are so addictive. Okay, I got off that soapbox because I got on it. Singing as loud as you can to the radio, and you know what's better than that? Karaoke. That's a really fun one. You can probably get a karaoke machine right now fairly cheap. If you ask real nice, you may could get one for Christmas. Treasure hunt. That's so much fun. Who wouldn't want to do a treasure hunt? Sack races. Hey, I'm so old. I remember a birthday party that my mother had for me to where she put like 6 piles of macaroni uncooked, and everyone got 6 straws and a little cup, and whoever sucked up the macaroni in their straw out of their pile and got them in the cup won. You know, old things like pin the tail on the donkey, you can make that at home. And the clothing baskets, I think that is so fun. That used to be a field day activity at school. 2, 3, ever how many you want to do, clothing baskets. Of course, you want to put items that would be really funny, and you might even want to assign who gets what basket or pull it out of a hat and make a race to who puts it on the quickest. Talk about some memories. Kids will love that. Parents will too. And so you are making memories, and it will take a conscious effort to make the best ones we can. This will be in the history books, and we will be sharing in later years how we dealt with this.
Absolutely. So COVID during the holidays, this is looking different for all of us. And I've gotten several different opinions and kind of just been just rallying people and saying, what are you all doing for the holidays? Because COVID is such a problem. And those of us with elderly loved ones, what is that going to look like? They feel isolated in and of itself because they're not allowed to see anyone at all. So one of the things that was recommended is scheduling specific times for different parts of the meal. So you'd break it up between different families, and you would share that time, say appetizers at noon, and then 2:00 entree, and then dessert at 3. So then you've got it broken up so that they know what you'll be doing at what times, and they can kind of share that with you and be a part of it. One of the things that I think my family will be doing is going to be Zooming the holiday from different households. So we're going to have about 6 different households on Zoom, and it's going to be chaos, and it's going to be great, just like we'd normally be together. There'll be kids running around, dogs barking, somebody complaining they want a nap, and the other one saying that they're ready for a conversation. So I think it's just going to look a little different for everyone this year. Writing letters, postcards, or care packages. Another idea that I had was to send care packages out to all of the young children so that they can Zoom together of them doing this activity so that they still feel like, A, they're being active and they're not sitting still, and B, they're doing something with their cousins that they would typically be doing if we were all together, but we're not all together because it's different. So, but they're still feeling like it's a part of a family function, a family fun thing with their cousins. So that's another idea, and that can be relatively inexpensive things, such as decorating ornaments, or coloring pictures, or building a snowman with cotton balls and Q-tips. Any of those little activity things. And Pinterest has a slew of different ideas. And those can be sealed and sent off in little envelopes. Just something for the kids to do together, I think, is another great idea.
And I would just tag on to Meg's. I think this is the earliest I have put up Christmas decorations. And I also think I've already enjoyed them more than I have probably since I was a 7-year-old looking at the twinkling lights. So that might be something that would bring you some joy, is the beauty. You can also get in your car and drive around and look at Christmas decorations and rate them. Everyone pick out their favorite house, rate them from 0 to 10. So warning signs is a loss of interest, isolation, anxiety, worry. Now, anxiety and worry are just a part of it, but what we're talking about is out of the norm or something you cannot shake out at. It's just constantly on your mind. You need to be able to relax, and if you're not able to, that's a sign. New or recurrent fears, something that you had maybe conquered in the past, and it's come back around. And in the mental health world, that means you're being triggered. It may be tied to a feeling of not safe, not loved, not good enough, those types of things. And in children, anger, crying, whining, aggressive or stubborn behavior. I know I just described most of everyone's kids, but I'm talking about out of the ordinary. And this is for kids, and this is for adults, going back to behaviors present at a younger age. That's back to being triggered. Be aware of yourself and learn your triggers. And it'd be nice to find the root of those and try to correct that negative thinking pattern. Avoidance of activities, or if there were to be any activities and you did, for example, if your church is streaming a service or if they're having online and you just suddenly have lost interest and that's new to you, that'd be a warning sign. Avoidance of people, persistent sadness, frequent crying, hopelessness, worthlessness, difficulty with concentrating, panic attacks, drug or alcohol use. So, and just to touch on drug or alcohol use, there is a real awareness and push for help now more than ever. And there are a lot of resources. What should be gone is the shame and judgment that has been attached to this. And hopefully anyone facing that would reach out and find that to be true. And of course, self-harm. Those last three there, you're going to need professional help, and some of the others as well. So please reach out. And I'm sure you could speak with Dave, and Dave can make a connection with you or to someone else for you. So you do not have to be in that alone.
So if you're experiencing any of those symptoms, or if you're feeling like you're just not getting what you need, reach out. You know yourself better than anyone else. If you are unable to deal with how you're feeling because of COVID or because of the loss of someone, or just how the holiday season's coming up, if you are feeling like you are not able to cope or manage your own feelings, reach out. Talk to a clergy member, a counselor. If you have an EAP with work, talk to a therapist, a friend, a mentor, your doctor. Sometimes your PCPs will recommend counseling facilities or a medication. Now we don't push medications, but sometimes your PCP will identify something that needs to be medicated. Or I've also attached the hotlines for the SAMHSA helpline, as well as the Tennessee crisis line, the phone number that you can text to the Tennessee mental health professional, as well as the National Suicide Prevention Lifeline. Of course, Health Connect America is here to help our communities as well. However, at this point, like mental health crisis of this nation, the important piece to remember from this is that if you need help, reach out. It doesn't matter where you reach out to, just make sure you reach out. Because there are lots of good agencies right now, including Health Connect America, that do want to help the community, our clients. I mean, that's really what this is about. It's because this isn't a marketing thing. It's the well-being of our neighbors, each other. How can we help everyone get through this together? We're all in it. We're all in it. You hear my child in the background. We're all facing the same things, maybe just a little differently than others, but reach out if you need help. And if we can't get it for you, we'll find somebody that can.
Absolutely.
Mm-hmm. So our final slide is remember we are all facing unprecedented times and must learn the optimum way to manage our lives. Be strong, help others be strong, and this too shall pass. And I have attached mine as well as Kellie's email addresses if anybody were in need for resources or information. We'll get to you whatever you need. Like I said, whether it be a program or service that we have to offer, or if it's someone else in our community resources. I'm big on getting people the exact service that they need, whatever capacity that might look like. All right, Dave.
Wow. I have taken 2 front and back full sheets of notes. This has been tremendously practical. Things that we can do in our daily lives with one another. Very helpful, practical information. And kind of what you said there toward the end, remembering that we are all experiencing this. And maybe just remembering that some of the things that we are experiencing, when you made a list of some of the things we may be noticing about ourselves, seeing that list and saying, hey, I may not be the only person who's experiencing this. This is normal. This is a part of it. Can just be in itself very reassuring in a way. So this has been tremendous. And maybe something that will come out of this time is sort of destigmatizing some of our need to feel free to talk about our mental and emotional health without there being any shame or stigma. Just like we would talk about the physical symptoms of
right.
But very matter of fact, this is what we're experiencing. I think you both of you shared very matter of factly, very helpfully, very practically this information. So thank you so much. Blessings upon you. I don't have any questions, and I was watching the Facebook feed, and I think we were all just soaking it in. So thank you for leaving your contact information if folks do have some questions that they can reach out to you. Again, I would encourage folks who are watching just to reiterate what they both have said. Reach out to someone if you'd like to talk to somebody, a clergy member, a therapist, counselor, just somebody, mentor, to reach out and just remember we are in this together, and we'll get through this together.
Absolutely. We sure will. Thank you so much.
Thank you. Oh, thank you so much. Blessings to you in this holiday time. Very much appreciate your time tonight. Thank you.
Thank you, Dave.